studies at Harvard in which she found that young boys had 5 to 7-fold increased risk of the osteosarcoma, the cancer, by the age of 20 if they drank fluoridated water during their mid-childhood growth spurt. The study was published in 2006, but it's been largely discounted by fluoridating countries because her thesis advised Professor Chester Douglas, a promoter of fluoridation and consultant for Colgate. He's got a dog in the fight. He's getting paid. So, that's why he's doing that. Now, after 5 years of waiting for the Douglas study, has finally been published. But in no way does this study discount Basin's findings. The study, which used far fewer controls than Basin's analysis, did not even attempt to assess the age-specific window of the risk. She was also fired, believe it or not. Fluoride may cause reproductive problems. Fluoride administered to animals in high doses wreak havoc on the male reproductive system. Once again, the pineal gland. So, keep that in mind, people. Some individuals are highly sensitive to low levels of fluoride. In one study that lasted 13 years, showed that about 1% of the patients given 1 milligram of fluoride each day developed negative reactions, and they suffered. There is no margin of safety for the several health effects. No one can deny that high natural levels of fluoride damage health. Millions of people in India, China have had their health compromised by fluoride. The real question is whether there is an adequate margin of safety between the doses shown to cause harm in published studies. I'm kind of fast forwarding through all this because it's long, and I'm giving you the highlights. Anyway, another safety factor is your thyroid. It interferes with your thyroid function. Environmental justice, low-income families penalized by fluoridation, those most likely to suffer from poor nutrition, thus more likely to be more vulnerable to fluoride's toxic effects, are the poor. Unfortunately, these are the very people that are being targeted by the fluoridation programs. No financial support is being offered to these families to help them get alternative water supplies or to help pay the cost of treating unsightly cases of dental fluorosis. Black and Hispanic children are more vulnerable to fluoride's toxicity. According to the Center of Disease Control National Survey of Dental Fluorosis, Black and Mexican and American children have significantly higher rates of dental fluorosis than white children. The recognition that the minority children appear to be more vulnerable to the toxic effects of fluoride, combined with the fact that the low-income families are less able to avoid drinking fluoridated water, and has prompted prominent leaders in the environmental justice movement to oppose mandatory fluoridation. Minorities are not being warned about their vulnerabilities to fluoride. The CDC is not putting the skull and crossbones out there and warning these people. So what's up with that, huh? That is our government's working. Tooth decay reflects low income, not fluoride intake. Since dental decay is most concentrated in poor communities, we should be spending our efforts to try to increase the access to dental care for low-income families. The real oral health crisis that exists today in the United States, it is not a lack of fluoride, but poverty and a lack of dental insurance. The largely untested chemicals used in fluoridation programs, the chemicals used to fluoridate water are not pharmaceutical grade. Instead, they're largely come from wet scrubbing systems of phosphate fertilizer industry. These chemicals, 90% of which are sodium fluorosilicate and fluorosilicic acid, are classified hazardous waste contaminated with various impurities, and arsenic, and it is carcinogenic. It is put in our water. So I find that this is really important, that I really need to talk about this to y'all. The silicon fluoride may increase lead uptake in children's blood, plus your blood. Fluoride may leach from lead pipes, brass fittings, and soldered joints that deliver the water. In tightly controlled laboratory experiments, masses have shown that the fluoridating agents in combination with chlorinated agents such as chloramine increase the leaching of lead from brass fittings used in plumbing. While proponents may argue about neurotoxic effects of low levels of fluoride, there is no argument that lead at very low levels affects the brain and lowers the IQ. The absence of studies is being used by promoters as absence of harm. This is irresponsible. It's all about the money. And the companies that are promoting this, they have dogs in the fight, and they're making money, they're earning money by poisoning you and me. Review panels handpicked to deliver a pro-fluoridation results. Every so often, particularly when their fluoridation program is under threat, governments of fluoridating countries handpick panels to deliver reports that provide the necessary re-endorsement of the practice of poisoning you. So anyway, I'm just going to put it, I'm not going to do the fancy talking that they do here. I'm just going to get to the point. The most recent example of these self-fulfilling prophecies have come from the Irish fluoridation. The anti-fluoridationists charge that does have some truth to it. Anti-fluoride forces have always claimed that many government-sponsored review panels set up over the years to assess cost and benefits of fluoridation were stacked in the favor of the fluoridation. So anyway, more and more independent scientists that are studying this are becoming more opposed to fluoridation. Proponents of fluoridation have maintained for years, many years, despite the fact that the earliest opponents of fluoridation were biochemists, that the only people opposed to fluoridation are not bona fide scientists. Well, that's not true anymore. Today, as more and more scientists, doctors, and dentists and other professionals read the primary literature for themselves, and rather than relying on self-serving statements from the ADA and the CDC, they are realizing that the general public have not been diligently informed by professional bodies on this subject. The statement list of senators can be found on the website of Florida Fluoride Action Network. These are the ones that are saying, yeah, let's go ahead and fluoridate. Proponents usually refuse to defend fluoridation in open debate, while pro-fluoridation officials continue to promote fluoridation with undiminished fervor. They usually refuse to defend the practice in open public debate, even when challenged to do so by organizations such as the Association for Science in the Public Interest. In light of the proponents' refusal to debate this issue, Dr. Edward Groth, a senior scientist at Consumers Union, observed that the political pro-fluoridation stance has evolved into a dogmatic, authoritarian, essentially anti-scientific posture, one that discourages open debate of scientific issues. Proponents use very dubious tactics to promote fluoridation. In other words, they're not up front. They're not up front. They're underhanded. Anyway, I made it to 50. There's 50 more reasons. So anyway, When it comes to controversies surrounding the toxic chemicals, vested interests traditionally do their very best to discount animal studies and quibble with epidemiological findings. In the past, political pressures have led government agencies to drag their feet on regulating asbestos, benzene, DDT, PCBs, tetraethyl lead, tobacco, and dioxins. With fluoridation, we have had 60-year delay, unfortunately, because government officials and dental leaders have put so much of their credibility online defending fluoridation, and because of the huge liabilities waiting in the wings. If they admit that fluoridation has caused an increase in hip fractures, arthritis, bone cancer, brain disorders, or thyroid problems, it will be very difficult for them to speak honestly and openly about the issues, but they must, not only to protect millions of people from unnecessary harm, but to protect the notion that at its core, public health policy must be based on sound science, not political expediency, not political being paid. They have a tool with which to do this. It's called the precautionary principle. Simply put, this says, if in doubt, leave it out. This is what most European countries have done, and their children's teeth have not suffered, while the public's trust has been strengthened. So, do you really trust the government to make decisions for you? I don't. Especially since, you know, this fluoride is classified as a medicine, and no medicine should be given to anybody uninformed, and not to mention that the fluoride that they're putting into the water is impure, full of impurities, and it is acid and chemical and toxic. So I just really felt that this was something I needed to talk on today. So next week I'm going to get on to the rest of the micro minerals and finish that out and move on to another topic concerning our health and wellness and our bodies and how to keep them healthy and live a little bit better, healthier, and longer. Anyway, if you know anybody who would be interested in watching this, please pass it on. And please subscribe and hit the like button. And just remember, each and every one of us out there, we are warriors on a battlefield against obesity and a sedentary lifestyle and toxicity. So anyway, thank you for dropping in this Sunday. And please email me if you have any concerns or questions, stellarmindbody@gmail.com. And thank you for watching. Woo!